Right, let's talk about one of the most controversial exercises in ACL rehab, the seated knee extension. You've probably been told, if you've had ACL surgery or hurt your ACL, that this is a dangerous machine. This is a dangerous exercise, just knee extension alone, because it places too much strain on the graft, and you should probably just avoid it. But here's the thing, that's not the full story, and if you're skipping this movement altogether, you might actually be holding your rehab back. Let's look at the actual data. In 2012, a paper by Escamilla and colleagues, they measured ACL graft strain during common rehab movements. And here is what they found. Lockman Test, which your physio and surgeon probably does more often than they probably need to, 3.7% strain on the ACL. Squat with 10 kilos, 4%. Single leg squat, 3.2%, seated knee extension with no load, 2.8% ACL strain. So the exercise everyone panics about is actually producing less strain than the movements that therapists and surgeons prescribe all the time. So what's the issue with knee extension? The studies tell us actually there isn't an issue, but what I have an issue with is how and when it's introduced, because I often find that therapists don't introduce it at all, or they introduce it really badly. And it's kind of like Goldilocks and how she likes her porridge, ready break, whatever you want to call it, but not too hot, not too cold, not too big, not too small. We need to get this part right. And I really don't think it is that difficult personally, because we just need to introduce it, steadily and use common sense. If somebody can't bend their knee to 90 degrees, we really don't want to be giving them a knee extension because they're not going to do it very effectively or efficiently. Same if somebody can't get their knee straight, why give them a knee extension to do an exercise and actually just not get the knee that straight? Use common sense. Don't put somebody on a leg extension machine really early, because the front of the knee is going to get so annoyed because we're just like hammering it in this really short range of motion, and the quadriceps are probably not even awake yet. The quads aren't even firing. So I think the use of knee extension should be in ACL rehab, and that's what the studies tell us, and it's certainly a really great way of building the quads because we isolate the quads, but I think that we need to introduce it in a really nice, normal, linear fashion. It doesn't cause any graft damage. It will stir up anterior knee pain if it's not done properly, and once you get anterior knee pain, that's a difficult one to get rid of. Some ways I like to teach patients and therapists how to bring it in safely is wait until the patient's got at least 90 degrees knee extension, knee flexion, start with isometric holds between 60 to 90 degrees, and then progress into controlled and short range reps whilst the quads are working, actively. And you can don't force full knee extension early on, ramming the knee into extension when it's not very good. Keep the load nice and light until the knee is ready. It's about using your head and being sensible, because the movement can be golden for lots of people, especially inner range quad strength, which so many ACLers do struggle with. And look, this isn't 100% as it may seem, because sometimes as therapists, our hands can actually be tied because some surgeons say no knee extensions for X amount of weeks, which is very old and very dinosaur-like, and I will normally write a letter or reach out to that surgeon and say, look, I understand your values and your beliefs, but is there any chance you can at least allow me to start kind of isometrics, especially with patella or quad tendon grafts where they lose strength so fast, and tendinopathies love to creep in if you don't load it right and early enough. But I would never overstep a surgeon's advice. If that's what they've said, that's what they've said. Whether I agree with it or not, I might try to negotiate around it, but we follow what the surgeon says. That's just how it goes. But things like this is a big reason to why I created my Complete ACL Recovery Guide, because there's so much guessing and too much fear-based advice and just not enough structure for ACL rehab. And my Complete ACL Recovery Guide walks you through every phase from day one post-op, even pre-op, to return to sport, what to do when and why, with proper progression markers and testing benchmarks, clear instructions for exercises just like this, how to start isometrics and how to do them. ACL rehab can be so confusing, and it's getting worse with online marketing and all these types of things of experts popping up everywhere. But it's about really following what the evidence base tell us and following research-backed rehab that's worked for years. We don't need new exercises that people are making up just to get likes, to get you back to sport. It's all about doing proper rehab that's been done, tried and tested, and backed by research. I'll pop the link to the ACL guide below. It's £89, complete step-by-step guide. Have a little look and it may be that missing piece to your ACL recovery. If this video has helped you, please give it a like or subscribe. I've got more coming on ACL rehab that really tries to cut through the noise and the nonsense. And if you've been scared of the knee extension machine, hopefully this will give you something to think about.